Hello, I'm Locke Meredith. I'd like to invite you to join me on the next Legal Lines. I have Jason Greene. He's a physical therapist here in Baton Rouge with Peak Performance. And we're going to talk about the role of a physical therapist in the care of a patient. Oftentimes, the patient will go see a doctor, and the doctor refers them to the physical therapist. We're also going to talk about how the doctor and the physical therapist communicates, what the role of the patient is with the physical therapist. We're also going to talk about the difference between a physical therapist and a chiropractor. So join us on the next Legal Lines with Jason Greene. Welcome back to Legal Lines. I'm Locke Meredith with Jason Greene on the show. He's a physical therapist here in Baton Rouge, and we're talking about what a physical therapist does. Jason, again, thanks for being on the show.
Thank you.
You were talking about you get the information from the patient. It's very important that they be thorough and describe all their symptoms. Then you do your evaluation of them, and now it's time to try and fix them. What does that mean?
Well, we set up a treatment plan, and in that treatment plan, the components of a treatment plan are normally therapeutic exercise, where they're doing stretching or strengthening exercises for the neck or the injured body part.
Now, the purpose of stretching or strengthening is what?
Well, what you want is the joint needs to move, and so muscles or ligaments get tight around the joint, and then therefore it doesn't move. And so we have to make sure that their body, their muscles are loose so that it prevents re-injury. Strength also provides stability to joints, so we want there to be strength surrounding the joints so they're not what we call hypermobile, where they have a lot of movement, and that is a risk for injury. And so we do the stretching and the strengthening. Range of motion can be active, them doing it, passive, us doing it, or even active assisted, them helping themselves.
And the purpose of the range of motion is for the stretching?
For the stretching and movement of joints.
Okay.
Where our body's composed of joints throughout our body, and they have to move. If they don't move, then they get stiff, and then you lose motion, and that impedes your functional activities. If you're going to go bend down to unload the dishwasher, or go to swing a golf club, or go to carry a box, if you don't have motion and strength, you're going to injure yourself.
All right, so we have the exercise component.
We have the exercise component, and then also we have modalities we use. We can do,
That's a fancy word for what?
Modalities are types of instruments that we use to try to help the body heal. Electrical stimulation, where we're trying to block little pain nerves from firing.
All right, what is that? We're talking about like a TENS unit?
TENS unit, which is, TENS means transcutaneous electrical nerve stimulation. All that means is you put pads on, and it stops the nerves from firing.
I've actually done that. It's an interesting thing where you put it on, and it's sending an electrical, impulse to you, and your muscles literally tighten up.
It's sending an electrical impulse, and it can be various. I mean, most of the time, if you're in pain, we're not trying to get muscles to tighten. We're just trying to relax the area and stop those nerves from firing. Okay. Secondly, what we do is we can do ultrasound. Ultrasound is using a sound wave through an ultrasound head to try to calm an area down, and brings blood flow.
Now, so
the purpose of that is
to increase blood
flow, because your body has agents in its blood that will bring healing to the area. But you have to increase that blood flow, and ultrasound is a form of doing that.
I guess toxins too develop?
Yeah, get all the toxins out of there. Your cells will kind of get that stuff out of there and clean it out. Then also we do, you can do moist heat, cold. There are other various forms of modalities we use. And then we use the manual therapy. And manual therapy consists of putting our hands on the patients, either through soft tissue mobilization. What that means is we're getting a muscle and we're trying to mobilize it, increasing blood flow. Again, a therapist's main goal is to facilitate that body to heal. Your body will hopefully heal. If you have a disease, sometimes that can impede that, like diabetes or arthritis. You have something going on there, and so we're trying to help your body heal itself. Mobilizations, I can show you in the spine. For example, you have joints within your spine that the joints are stacked on top of each other, and these are called facet joints. So mobilization just means, say you're stiff in this joint here. This is L5 and this is L4, your lumbar segment. Well, we want to get in there and try to move that joint around, because if that joint's not moving, then you can't bend forward or you can't extend, and that impedes your functional activities. And as you see, nerves travel through here. So the manual therapy consists of hands-on treatment that we're trained to do to try to help any part of the body improve.
Let's talk to folks about, I know a lot of folks hear about the disc injury, whether it's in their neck up here in the cervical spine or in the lumbar spine. And a disc injury, as I understand it, these are the discs that allow mobility of the backbone. They're like cushions, shock absorbers. And they sometimes, through trauma or aging, will actually crack open or split open or just bulge out, and they'll start hitting nerves. If it's down in your lower spine, causes pain, numbness, weakness, down your legs, depending on whether it's to the right or left. Same thing up in your neck. These nerves, the brain's sitting up here, spinal cords going down here, and these nerves are feeding the arms, and the disc may be hitting those and causing symptoms. How do you treat those injuries?
Well,
I guess differently or
you
the same way?
You do. It depends on where it is. A lot of times, if you see this red part right here, that shows kind of what a herniation would look like, where the disc is out of this column, okay? And the thing to remember about disc is they're largely made up of water. Okay, so you need to be, hydration is really important. But what happens is they are shock absorbers. And what happens is if you get an accident and you have force going through there and it hits the nerve and it irritates you, or you can get degenerative disc disease, or you lose disc height. The way you treat that is twofold. Normally with a disc problem, you're going to have loss of motion. So we want to do pain-free movement. You're going to probably have movements that aren't painful.
So if your body's hurting, probably means don't do it?
Well,
at least
don't go into the pain
fashion.
in the initial stages, yeah. And that's why it'd help you to be in some form of therapy to kind of, we can monitor what's painful and set you up on some stuff.
Okay.
And then also you can do some rotations and other things to help with that.
We had another model here because these are frankly typical injuries that you see.
Yes.
This was dealing with disc injuries and I guess back muscle sprains and
Exactly.
strains. Here's a knee model.
Yeah.
Tell the folks what you do typically as a therapist.
Well, what happens with the knee is you have ligaments that are inside of the knee and here, and one of the most common injuries you all see is the ACL. Anterior cruciate ligament, and it tears, and so they do surgery.
And as a ligament, its function is to keep the bones together?
Exactly. It provides stability to the joint because your knee connects to this bone, and so what happens is it provides that stability to prevent it from shifting. So we see some ligament strains in here. This is also a ligament on each side. You can get sprains there. A ligament is normally sprained. A muscle is normally strained. And what that means is this doesn't show the muscles, but you can have various muscle strains. And what we try to do is set them up on a therapeutic exercise program to improve their quadriceps muscle or their hamstrings muscle, and also just give them some stability around the joint.
I guess if you've got an ACL injury, you're probably going to have soft tissue muscle sprains and strains.
Exactly, because when you tear an ACL, even if you don't get surgery, that joint doesn't want to move because you have a lot of swelling and bleeding inside the joint.
So initially you're dealing with, I guess, pain alleviation?
Yeah, initially we want to try to reduce pain in what we call the acute stages, normally in the first week after an injury, and then as we get into there we try to get movement back and strength back. Because your body responds to injury. Your body's very smart. It shuts down certain areas to try to prevent swelling and further injury to the area.
What is the typical period of time that treatment's going to be provided?
Normally, we'll treat patients from 4 to 6 weeks. Some patients we see in 2 weeks and they get better, and we'll discharge them at that point. Some patients we see for 3 to 4 weeks, and some patients we see 6 to 8. It kind of depends on the diagnosis. What happens is if you have a pretty simple diagnosis, a muscle strain, it's strictly muscular, no nerve or joint problems, it's going to get better hopefully within 3 to 4 weeks.
What is the difference between a physical therapist and a chiropractor?
Well, physical therapists, we are trained, as we mentioned earlier on the show, we're trained in part of the medical model. What we want to do is we look at how the body heals, how the body responds. And we do mobilizations of different joints, meaning move them like I just showed you. Chiropractors do manipulations. We also do manipulations in the body in certain parts, but it's more of a theoretical difference than anything.
All right, well, let's talk about that on the next segment. This is Locke Meredith, Legal Lines, and Jason Greene's on the show today. We'll be right back. Welcome back to Legal Lines. I'm Locke Meredith. Pleased to have on the show Jason Greene. He's a physical therapist here in Baton Rouge, and we're talking about what you guys do for folks. And we were talking about, I've actually had a chiropractor on the show in the past, and we're talking about the difference between the way you folks treat, say, an injured party and a chiropractor.
Yeah.
Go ahead, tell me about it.
Well, as we previously mentioned, we kind of are part of the medical model. So, we have a
So does that mean chiropractors are not?
Not necessarily, but I will say that, we're trained at health science centers, and we kind of fall a little bit more under the lines of how physicians are trained and things like that. Don't really know a whole lot about chiropractic training. However, I will say the primary difference is more of a theoretical difference.
And what do you mean by that?
We believe that the body is made to be in certain systems. And those systems are like your musculoskeletal system, which is your bones, and your cardiovascular system, which is your heart, your digestive, all that stuff. And we believe that those systems work together, but also they function in certain parameters within the body. Chiropractors you know, when you get into the spine, let's take the spine for example, they'll do manipulations which are high velocity thrust movements of the spine.
And we talked about grade movements.
Graded movements are, when we talk about mobilizations or manipulation, let me just explain those. We're talking about joints that move, and you have them all throughout your body.
Elbows, knees,
hands,
hips,
fingers, neck, spine,
back,
knees, ankles, and those joints need to move. And the mobilization of a joint just means that we are trying to move those two surfaces on each other to try to enhance the range of motion. So you have a grade 1, which is real gentle, and then you go all the way up to grade 5. And a grade 5 mobilization is a manipulation. It's a high velocity thrust movement. And therapists are trained to do that with continuing education and experience, because as you know, if you do a manipulation on somebody, there are consequences if it wasn't indicated. So chiropractors do a lot of manipulations.
And I guess their manipulations are this grade 5.
They're grade 5 movements.
Significant, severe
thrust movements. And again, therapists do that as well. Also, I think a major difference in chiropractors is we have a therapeutic exercise component. Our whole goal in physical therapy is to get the patient better and healed so then they can go on to their normal lifestyle. Again, that chiropractors' goals are that as well. However, we have a therapeutic exercise component, and I'm not sure.
Some may and some
may and some don't.
It's interesting because, frankly, you know, you hear differing opinions of the value of chiropractic care. You got some folks who, I think you've even said, will live and die by them, just say they're extraordinarily helpful, and other folks that say they'll never go again. Is that because of the type of injury that was being cared for?
A lot of it does have to do with the type of injury, Locke. I mean, you know, if you have a disc bulge or some type of spine problem, then you're probably going to be in physical therapy. You maybe even go into a chiropractor at the same time. And so, you know, sometimes, as we previously mentioned, I've had patients that, you know, have been to me from a chiropractor, or they've been to me in addition to a chiropractor. But it does depend on the type of injury. There's, you know, as you know, in medicine and in the healthcare field, there's really very seldom a, you know, recipe type of, you know, this is definitely what's going to work. It's all patient dependent, and that's why it's so important that you involve the patient every visit on how are you feeling today? What are your symptoms? Let's address those symptoms so then you can get back to your lifestyle.
All right, well, let's say now somebody's seen you for the customary period of time for the particular injury that they've come there for, and they're doing better. They're feeling great. Is their care with you terminated, and are they just back thrown out into the world, or is there further directions to them?
Well, what we try to do is we try to, all throughout the patient's care, do patient education.
Which means what?
Which means educating them on how you were injured and injury prevention. Because if you don't do injury prevention to patients, then they're going to re-injure themselves.
All right, and injury prevention is typically what?
Typically
strengthening and stretching?
The stretching program we've implemented for you, strengthening program. Postural education is big, specifically with the spine.
Meaning how you sit, stand, walk
during the day and work, and also we can get into ergonomics. How's your computer set up at your desk? Do you sit slumped all day with your head forward? Your neck's going to hurt at the end of the day.
Well, let's face it, as you get older, you deteriorate.
You do deteriorate, and so some of this stuff is irreversible. When they're done with us after a 4 to 6 week rehab process, what we do is we discharge them, and we give them instructions upon discharge. If it was an acute injury, a small little muscle strain, then hey, just know that you knew what happened. This is how you prevent that. If it happens again, come in for treatment. If it's more of a chronic problem,
like a disc injury, that normally doesn't go away.
Yeah,
it's
I mean,
permanent.
you know, it's going to be there, and so we try to teach them on signs and symptoms to look for if it happens again. If it happens again, then you know what helps you. Now let's discharge you. Now, I think that is our whole goal is we don't want to discharge patients too soon, because then they're out into the world and they don't know how to manage. But we don't want to hold on to patients too long, because then that way, you know, they don't know how to be independent with their care. And the patient is so big and an important part of their care, because it's their body. They may come to me for an hour, but they're with their body 24 hours a day. So it's important that we are a team effort, and then when I discharge them, normally I'll have them contact me in 2 weeks, let me know how you're feeling. If you're feeling fine, then we'll finally discharge you.
Now, do you have a way of kind of separating the moaners and groaners and exaggerators and malingerers and all that kind of stuff from the folks who are legit?
Yeah, I mean, there are ways that we're trained in doing. You know, there are certain signs that we can test patients on that we know this shouldn't hurt. And if it hurts, then we kind of know that you're probably not telling us the truth. But most of the time, most of the things we see, that we've seen them, they've seen a doctor, and so therefore they've had a thorough workup by us and a physician, and we try to communicate with everybody involved with their care. If this is not a serious injury, then you shouldn't be here probably any longer than a month. Some serious injuries require longer than that. But a lot of times you can get feedback from the patient, kind of like a patient interview, and kind of read them on how they're really feeling.
And if you discern that somebody's moaning and groaning when they shouldn't, I guess you notify the doctor about that.
We notify the doctor and everybody involved in their case that, look, this is what we kind of see, this is what we kind of perceive happening. And again, we don't want to jump to conclusions.
Is there a presumption that the patient is being honest?
Yes, there is. Anytime we evaluate a patient, we assume that you're here because you have an injury or you have something that we can help. And then, honesty is important, and then very seldom do we have that case where there's not some type of problem in the body that we can help. But if there is, we definitely communicate with the doctor.
Well, how does doctor physical therapist communication take place? Is it strictly the written reports that are exchanged, or do you guys get on the phone and say, hey, man?
Yeah. Sometimes it's written referrals. We do a written evaluation that we send to every doctor of a patient that we see based upon our findings and our plan. And then also sometimes in cases we do get on the phone with a physician and say, this is what we're seeing. What patients often realize when they come to a therapist is that they see a physician, they're going to follow back up with him in a month, 2 months, or 3 months. We're seeing patients 2 to 3 times a week. So we like to convey that information to a physician through a progress report, a discharge summary, an initial evaluation, and also sometimes verbal conferences, because that gives the physician a better picture when he goes in there for 10 minutes to visit with the patient, what's going on.
It's interesting, too, because oftentimes there are more than one type of specialist physician. I assume y'all want all the medical records or at least know about all the treating physicians so you can provide that.
Yeah, we do. Thorough documentation and thorough medical history is very important, so then we can get that patient back to full function.
Jason, thanks for being on the show.
Thank you for having me.
Locke Meredith with Legal Lines. We'll see you next time.